Thank you very much, Dr. Howden. I'm very happy to hear, to have a presentation and this opportunity. And I really appreciate Dr. Howden to give me this opportunity. First of all, I like to say this is a very unusual situation in Japan, in the world, under the coronavirus outbreak. And I'd like to share with you several key points of WHO's work, WHO's role in combating against the communicable disease outbreak, including the current outbreak of the COVID-19. But before starting that, just let me say about the how to protect yourself. And the very important thing is to avoid touching to other people as much as possible. For example, please don't shake hands, avoid shaking hands. And also when you touch someone, please wash your hand later. And also regularly wipe your desk, wipe your chair, wipe what you touch, because the COVID-19 virus is surviving on the surface of the things, as well as it is spread by the droplets, by coughing and sneezing. So please avoid the crowded place. And if you have a sick, please stay home. Those three things are very important key messages to protect yourself. So let me start my presentation about the COVID-19 and WHO's role, as well as the WHO's role in education too. Let me share the slides. So could I ask you if it is, you can see it or not? Can you see it? Yes, great. Great. So let me start my presentation. The first slide, the title is WHO Role in Emergency 21st Century Challenges. That includes not only the COVID-19 current outbreak, but also the history of WHO combating against the communicable disease outbreak. Okay. So for those who don't know so much about WHO, I'd like to introduce ourselves. WHO is the directing and coordinating authority on international health within the United Nations system. We are in charge of health in the UN family. And we experts produce health guidelines and standards and help countries globally to address public health issues, including the communicable disease outbreak. Our headquarters is, as introduced, in Geneva, in Switzerland. Now, the Geneva office is also promoting the teleworking under this coronavirus outbreak. He is our Director General, Dr. Tedros Adhanom Ghebreyesus, our leader. And he is doing very frequent risk communication with the public regarding this coronavirus outbreak. So our role is basically we have 6 roles. One is a leadership, taking leadership in public health issues. And shaping research agenda, one of our centers' role is to contribute to the shaping research agenda by conducting policy research in collaboration with the international academia. Also, we are setting norms and standards and giving policy options, evidence-based policy options to the government. And also another important part of our role is to support countries, especially the countries lacking capacity of medical services or health services, health systems. Our offices are all over in the world, especially in the low and middle income countries. And we monitor the world and assess the situation and take appropriate actions. We have 194 member states, including, of course, our country, Japan. The structure of WHO is like this. We have 150 country offices. As I mentioned, one of our roles is to support countries. The country office, the first level of our office, is has a mandate to support countries. But the country like USA, country like UK, Japan, or other high-income countries, they don't need WHO support. So those countries that don't have the WHO's office, country office, So country office is governed by the 6 regional offices. The green area, including Japan, China, South Korea, Republic of Korea, is defined as a West Pacific region. And it is governed by the Philippine Manila. There is a Western Pacific regional office. So similar offices are in Copenhagen, Europe, and Washington is an American region. The Congo, Brazzaville is an African region. And Cairo, Egypt is an East Mediterranean region. In New Delhi, India is a Southeast Asian region. Those 6 regional offices are managing the work of the WHO country office and also region work. And so all those work are supervised by the headquarters in Geneva. The Kobe Center is a little bit unique position in this structure. The Kobe Center is a part of headquarters, but we are not located in Geneva. We are established in 1995 as the symbol of recovery from the Great Hanshin Awaji earthquake. There was a huge earthquake in Japan and a very historical earthquake, the natural disaster event in Japan in Kobe. And the process of the recovery, the governor of the Hyogo Prefecture took a very strong leadership with the slogan of the Build Back Better. And they decided to invite the international organization as a symbol of recovery from the Hanshin earthquake. And that was the reason why we, the WHO Kobe Center, was established in Kobe. So since then, we have working for the global health issues, especially in terms of policy research on global health issues. That is a brief introduction of WHO Kobe Center. If you have any questions, please let me know with a chat. I can respond to you anytime you want. I'll check the chat frequently. So now we are working for the Sustainable Development Goals. Maybe you may be familiar with the 17 goals for the development of the world. The WHO are in charge of this number 3, good health and well-being. WHO is currently working under this general program of work, GPW 13. It's linked with the SDGs. And we have 3 billion goals. 1 billion more people enjoying better health and well-being. This is healthier populations. 1 billion more people better protected from health emergencies. That is also a very important part of the work. And another one, universal health coverage. That is also a very important part to cover all the people with appropriate health services. So 1 billion more people benefiting from universal health coverage. Those 3 are the major goals of from this 2019 to 2023. This is a picture of the latest map of COVID-19 spread in the world. Unfortunately, almost all the country or territory or area of the world are already affected by COVID-19. 190 countries, areas, territories are affected, and more than 300,000 people infected, and unfortunately, more than 14,000 people, 14,652 people died due to the infection. So you can see the red circle, depending on the number of the cases in the countries. It will increase. It will increase because now the countries are testing. Now it's spread. So, but all the countries are still in the period of very important period to contain, make effort to contain this disease. So our Director General declared the pandemic. However, it doesn't mean that we have no way to protect ourselves or contain this disease. We need to emphasize again that now it's time to make every effort to contain this disease. So to talk about WHO, I'd like to go through some history of WHO's work or international society's work, 20th century to 21st century, to combat against infectious diseases. This is the poster of World Health Day. You may know World Health Day is 7th April. This is the date of the establishment of WHO, 1948, 7th April is WHO establishment. And every year we celebrate the establishment day as the World Health Day, and we advocate the important key global health issues as a theme of the WHD, World Health Day. And 1974, the theme was a vaccination, immunization. Vaccination was a very key issue because the vaccination could help a lot of children and people, life. So that was the important key message of the global health at the time, 1974. With the efforts of this vaccination, we could achieve a very important milestone of the combating against the infectious disease management. This is the elimination of a smallpox, 1979. After that, so many communicable disease was addressed by WHO, international society, and each country, each community. However, at the time of, as of 2000, millennium, there are still so many people who are affected by infectious disease, who killed by infectious disease, and who have no way to protect themselves, to cure themselves, to treat themselves. That was highlighted in the Millennium Development Goals. It is a previous international science goal before SDGs. This is called the MDGs. MDGs are the 8 goals of the international society as from 2000 to 2015 to addressed by all the countries in the world. And interestingly, this is a whole society's goal, but the 3 of 8 are related to health. The first one is a goal number 4, to reduce child mortality. Number 5, improve maternal health. Number 6, HIV/AIDS, malaria, tuberculosis, and other infectious diseases. Those are based on the lack of drugs, lack of health services. So there were drugs sold on the market, but so many people who are most vulnerable and most infected couldn't have access to get those drugs. That is why just a simple pneumonia, just a simple diarrhea could kill so many children, so many pregnant women, so many vulnerable people. That was the situation of the 2000s. You can see this picture. This picture shows how rich the world was at the time of 2000. Green countries are high-income countries, red countries are low-income countries. So you can see this picture that where are the rich countries? Only North America, Europe, North Europe, West Europe, Central Europe, Australia, Japan, that's it. So most Asian and African countries were poor. And there were no mechanism to save the most vulnerable people in those areas. There were drugs, but the people who need the drug couldn't buy it. And there was no mechanism to give them the drugs if they don't have money. So that was the situation of 2000. So that is why so many people, so many children, so many women died due to the lack of resources. So MDGs address this issue. For example, the Global Alliance for Vaccination and Immunization. This is as called the Gavi. They did very simple but important work. What was that? They collect money from rich people, rich countries, rich foundation, and buy vaccine, and give them to the most vulnerable people. That was very simple work, very simple mechanism, but very important. And there was no mechanism, such a mechanism in the world at the time. So the Gavi's work very helpful to save those children. Another one is global funds. maybe you may know the HIV/AIDS is a very dangerous disease to kill the people by compromising the immune system of the human. But now we have a good drug to keep the immune system not to die only by the HIV/AIDS. So you can control the HIV/AIDS for some amount now. But in 2000s, there were also drugs, very effective drugs, but it was expensive, and many people who need it couldn't buy. So this global fund did a same thing like a Gavi. They collect money from all over the world and buy the drugs and then give it to the people who need it. That made a very big change. You can see this slide. In 2002, less than 500,000 people could get drugs. But in just 6 years, it comes up to more than 4 million. This is the power of public health and policy, health policy. That is the quite significant improvement of the covering people's health. That is our big achievement of the MDGs. So it was also highlighted in the CDC's report in 2010. So that was a great achievement of fighting against the communicable disease in 20th century and the first beginning of 21st century. But currently or recently, the world got a little bit complicated. That kind of communicable disease management is one part of our challenge. So those challenges were addressed by the giving drugs to people, because it's treatable diseases. But currently, what we are facing is there are some non-treatable or not normal, very new emerging diseases, which is also spreading to the world and affecting lots of people. The first example is a 2009 H1N1, the new influenza. It spread all over the world very rapidly, but fortunately, it didn't kill people, so many people. This is another example, a very shocking event. It was 2015-2016. It's a MERS, Middle East respiratory syndrome. That is the disease infected from the camel, and it kills more than 30% of people. It's a very dangerous disease. Fortunately, it doesn't, infectious power is not so strong. It doesn't spread so easily, but human to human infection is occurred actually, and it's a fly from Saudi Arabia to the Republic of Korea, and it spreads from just one index case to more than 100 people and killed more than 30 people. That was also shocking news. But now we are facing another challenge, the COVID-19. It spreads a lot, very easily, and the mortality rate is not so low. So that is our current challenge. Please look at this movie. The movie shows how many planes are flying in the world. The darker area is night and vice versa. And you can see the 24/7. So many people and materials are flying and moving, transporting for this world. So this situation is the current globalization situation. So under that globalization, globalized world, how to protect yourself, how to stop spreading the disease. That is very, very difficult. Maybe you may know the word, the term, the incubation periods. That when you get the disease, the virus or bacteria into your body, and it takes 2 to 7 days usually to get symptomatic. But in these 2 days, in these 7 days, you can cross the border of the world, the border of the country. So that is the current situation. So the quarantine, the port, airport, of course, they are monitoring the people if they are not infected or not. However, just in 2 days, just in 1 day, you can cross the border. So during the incubation period, you can cross the border anyway. So you can get into. So quarantine doesn't work in this case. So how to manage that situation is very, very difficult. And the world is getting more complicated. For example, this urbanization, people live closer. So that is a risk of the spread of communicable disease. So world population is changing very rapidly. And for example, in 50 years ago, the majority of the population of the world was living in the rural area, but now it's the opposite. So it's in 2030, more than 50%, 60, 70% people will live in city. People live closer and closer in very crowded and very concentrated area. That is a current situation of the world. Maybe that is effective for the economy, but it is very effective at the same time to spread the communicable disease. And not only the people getting closer, the vulnerability is increasing. For example, not only the urbanization, but at the same time, there is health inequities, poverty. Population increases in the low and middle income country, especially rapidly. So many people concentrating to the city of the low and middle income countries, and they are competing each other in the economy. At the same time, there is a winner and loser. And there, in some cases, or in many cases, in those newly developing countries, there are not enough the strong health or social system to protect the weak people. So there is significant health inequities. For example, in Africa, the rich people and the poor people's, the mortality rate of the children under 5 is such different. This is the current was a little bit before, but the situation of the world, there's a big difference between rich and poor. And slums in the world. So the people living in slum don't have a good access to the health system, don't have good access to the social system. They are not protected. So once they get infected, get sick, how to protect them? This is a very difficult issue too. And this is shocking data. It's 2012, but by the UN Habitat in Asia. For example, in Bangladesh, the proportion of the population in slums are more than 60%. That is a very shocking data. So how to protect those people? Another one is, I'm running out of time, but another one is global aging. The world is getting complicated. So this is sorry, very rapidly, I'm proceeding the slides, but this is a picture I showed you. The high-income country, low-income countries, rich and poor in 2000. So in 2000, the high-income country limited, and Asia, Africa was poor. However, it's changed like this. In 2020, many countries got improved in economy. And actually, the low-income country is a minority of the world. It means that so many people can get more food, can get more drugs, and they are protected a little bit. So extension of the life expectancy. So the people live longer in every country in the world. At the same time, due to so many reasons, the fertility rate is declining in every country. Then now the number of the people under 5 is much less than the number over 65, the number of the people who over 65 years old. And global aging occurs. So the high density area is more older countries, whose population of over 60 years old is more. So in 2015, the country which has the more than 30% of the over 60 years old people is only Japan. But in 2020, Germany and Italy catch up, and 2025, 2030, 35, 40. So world is getting matured. So you can see the aging is not the issue of the rich country anymore. Aging is occurring everywhere in the world. So it means that so many older people are in the world. MCDs, non-communicable disease is also occurring. The problem is so many newly developing countries doesn't have time to prepare for this aging. For example, France has more than 100 years to prepare for this aging. From the stage of the 10% of the population is over 60 to 20%. They had more than 100 years. Japan had 25 years, but much shorter. But Japan was lucky because in 1970, Japan already experienced economy development. So it was much easier to prepare. But other countries like other low and middle income countries, it's a very big challenge how to prepare the health system for this global aging. And now this is the picture again of the COVID-19. If there is no protection or no public health measure, the R0 is the number of the people for the infection. From one person, how many people to infect spread the disease? There's a 2 to 2.5. That was the data of China. And it spreads if there is no protection, no public health measure. The capacity of the country is weak. If the capacity of the country is weak, it spreads much easier. So, this mortality rate is much less in the young people, but actually over 80 years old people, it's within the China data, that is over 20%. Japan is a country which has 30% of the population is over 60. So we are now facing very big challenge, how to protect those people, vulnerable population, how to contain the disease. Again, MDGs was a very important goal, but world changed it. And now we are facing very complicated goals. This is SDGs, Sustainable Development Goals. WHO is working for the number 3, health and well-being. And those 3 messages I'd like to share with you in the end. Be ready for coronavirus, be safe from coronavirus infection, be smart, get good information, accurate information, and be kind to others. Thank you very much.